Good morning, good evening, good afternoon. This is BIO112. This was to be today, the Thursday before our last day, June 9. And we already went over all the chapters except for the last set of chapters on what looks good for the final exam. And remember, on average, there's only going to be 4 or 5 questions per chapter. So more like 4, because there's 13 chapters and there are 50 items. So you do the math. So let's look at sample bank questions from chapter 11, and I can tell you what looks good. What are definitely must know at this point. If this thing would load up. Okay. It's not duplicated. I don't want it. Now, right off the bat, a coverings question. That's important. So you know what the meninges are. I'm not going to ask that, but I'm definitely going to ask 2, 3, and 4, something like that. So where would you find your CSF? Which is the tough outer layer? Which is the thin, most inner layer that has the most blood vessels? So know your dura, arachnoid, and pia mater. So the answer to number 2 is, of course, dura. The answer to number 3 is, of course, arachnoid. And the answer to number 4 is pia mater. This is number 5 is nice to know. 6, no, forget it. 7, forget it. Now, the parts of the brain, especially the lobes, must know. Something's going to come out, right? And the major structures, especially the ones that we went over in laboratory in the mid-sagittal section of the brain. So decision-making, right? Of course, the cerebrum, specifically your frontal lobe. What structure houses your cerebellum? Now, I'm not going to do a forebrain, midbrain, hindbrain, but the answer to this particular question is, of course, hindbrain. What is the function of your frontal lobe? Problem solving, decision making. Parietal lobe, think motor and sensory. Occipital, think vision. Temporal, think auditory. If I'm going too fast, please pause the video, rewind. Because I'm on Zoom. I only have 40 minutes to do this. Well, it's going to take a lot less than 40 minutes, but you know, I also talk fast. This was also on your exam, Broca's area, right? Yes, leave me alone. Which of the following, Father of the Year, everybody. Which of the following in your diencephalon don't need to know, right? I'm not going to do proencephalon, diencephalon. It's too specific. We're at the final stages and what's nice to know. But homeostasis and the hypothalamus, yes, that's a good thing. Pons and the regulation of breathing, yes, that's important. Medulla oblongata, cardiovascular and respiratory integration, yes. The RAS, nice to know. Reflexes, we already have enough reflex questions. Interneuron and your spinal cord regarding the reflex arc, yes. Afferent versus efferent fibers, yes, that's important. Cranial nerves, know the number, know the name, and its generalized function. So cranial nerve 1, olfactory. Cranial nerve 1 is, of course, smell. Cranial nerve 8 is, cranial nerve 7 is facial nerve, you know, sensory and motory of your face, right? Motor movement of your eyeballs. Cranial nerve 3, 4, and 6. Cranial nerve 8, hearing and equilibrium. And you know how it goes. Now, lifestyle changes. I already beat that thing to death in the quizzes. So will it be really on the final? The answer is a flat out no. So, but lifestyle changes essentially are what? Everything's decrease, gray matter loss, shrinkage of your brain, decreased level of neurotransmitters, decrease of memory, right? And significant pathologic decrease of memory is called dementia. Less sleeping hours, right? And of course, what happens to your action potential? It gets slower. So that is chapter 11. Let's look at chapter 12. Now, sensory system, skin, think what? It's all over your body. It's generalized. But anything in your ears, nose, mouth, anything in your head, that's special. Definitely know the different kinds of receptors. What kind of receptor is located on your tongue and your nose? That's a chemoreceptor. What kind of receptor deals with pain? That's a nociceptor. What kind of receptor deals with changes in temperature? That's a thermoreceptor. What kind of receptor monitors blood pressure and also deals with your Golgi stretch tendon? Mechanoreceptor. What receptor responds to light waves, right? Like your retina, photoreceptor, right? Again, another homeostasis question. That's a must know. Extraceptive, interoceptive, and proprioceptive. Nope. I don't think I put it on there. But let's just review it because it's here anyway. And you never know. I might have been in a mood. It was early this morning when I made this exam. Think what? Anything on the outside, touch, temperature, pain, extraceptive, right? Anything on the inside, like your viscera, like blood pressure, interoceptive, and anything that deals with your body position, P for position, proprioceptive. Know the difference between Meissner's and Pacinian. If you don't know by now, I should just have the right to fail you. I am semi-joking on that statement. Referred pain, a nice example is a heart attack. A nice example is chest pain and a heart attack. A nice example is also flank pain when you have kidney pathology. Emotional response, think limbic system. Corpus callosum, think connection between your left and right hemispheres. Enkephalins, endorphins, and serotonin inhibit pain. That's why we talk about the runner's high. Brings you to the happy place. Olfactory is smell. Gustatory is taste. Inner ear is equilibrium and hearing. Remember, cranial nerve 8. How many times did that come out in the last several chapters? Taste sensation. You guys know that from the picture of the tongue that was on lab. Eardrum, tympanic membrane, smallest bones in your body, ossicles. Tube that connects your middle ear to your throat, eustachian tube. Cochlea, think hearing. Semicircular canals, think equilibrium, balance. Auditory cortex of your brain, temporal lobe, cranial nerve 8. My goodness, how many times did I ask that? Jeez. Tears, I don't think I asked too much on that. Remember, only 3 or 4. Autonomic nervous system, I asked 1 or 2 questions on that. Rods and cones, I might ask 1 question on that. Cones, think color, day vision, visual acuity. Rods, think evening. And of course, none of this stuff. And that is chapter 12. That's must know at this point. Let's now go to the last one, chapter 13. And remember, next term, no more test banks. You get to do this all by your lonesome. And create your own Kahoot. You know what I'm thinking? I'm thinking maybe you guys go do it. Maybe that should be an assignment every week. The class gets to create a Kahoot based on what they believe should be a sample question. Now we're the glands, the very last one. What looks good? I'm not gonna ask location. So 1, 2, and 3 are out. 4 is out. Endocrine, we know that's what? Internal, endo. So I'm not gonna ask that. Miracrine, apocrine, holocrine. I think I have one question on that. And if you don't know that by now, I don't know. Characteristic of the endocrine system, it's slower and has longer effects. It's both. But the following, nice questions to come out. I'll give you the hormone. You give me either the target or its function. So, of course, somatostatin, it'll stop growth. Target is muscles and bones. Growth hormone will promote growth. Target is muscles and bones. Prolactin will promote lactation or the milk letdown reflex. Target organ is the mammary gland. LH, FSH, think ovulation. Target hormone are your, of course, gonads. In female, it's your ovaries, and male, it's the testes. Thyroid stimulating hormone, think metabolism. Remember the story I talked about? If my patient has heart trouble, I have to check out their thyroid. ADH, antidiuretic hormone. It tells my target kidneys, stop peeing. I need to keep my water. Calcitonin, think parathyroid. Think bones. Think calcium stores. Oxytocin, think childbirth. Target tissue is the uterus. T3, yeah, just like TSH, T4, and TRH. Which the following contraction? We already did that. Neurotransmitter in smooth muscle is what? Epinephrine and acetylcholine. And cortisol. It does what? Decreases immune system and inflammation. That's why we give corticosteroids. It looks like cortisol, acts like cortisol. Yes, it decreases inflammation, but it also does what? Decrease immune system. Definitely need to know insulin and glucagon. Definitely need to know that's from the pancreas. You definitely need to know when does insulin get secreted, when does glucagon get secreted. Insulin gets secreted after a big meal. Glucagon gets secreted when you haven't eaten for a while. And all get secreted by the pancreas. Target tissue is, of course, liver for either glycogenolysis or glycolysis. System control for homeostasis and including hormone control is always negative feedback. Negative feedback. I'm not even going to talk about the other side. That's it. Excuse me. Oh, geez. Phlegm. That's it. And that's why I really didn't have a session today, because we kind of went over it already when we were preparing for our last exam. But the items that I just talked about now are like must know at this point. So those are the ones to focus on. And remember, keep generalized, keep high value topic, and you guys should be fine. I cannot stress, do not miss this exam tomorrow. If you're in the low 80s, it's make or break. If you're in the high 70s, it's make or break. Okay. It's 20% of your grade. So do what you need to do. I'm going to get some sleep. And I already wrote the stuff on the board. I don't know. I was bored. Hope no one's erases it. So I'll see you guys tomorrow, bright and cheery, 8 a.m. Good luck. Bye.